Hey everyone, welcome back to my anatomy series. I'm Hajira and today we're going to study a bone that looks very silent, but honestly, without this bone, your shoulder joint would never work properly. We're talking about the scapula, also called your shoulder blade. This chapter is actually super simple. Once you understand the flow, the whole bone becomes easy. Alright, where is the scapula? So, first, let's just imagine where the scapula sits. If you place your hand behind your back and feel the broad flat bone, that's your scapula. It lies on the posterior lateral aspect of your chest wall, roughly between your second and seventh ribs. Now, this is important. The scapula does not attach directly to your ribs, it only rests on top. Because of that, it can slide, rotate, and move freely. And that is why our shoulder is the most mobile joint in the whole body. So think of a scapula as a movement platform of your arm. Now, if you look at the bone, the shape is actually triangular. Since it's a triangle, we automatically get three things: three borders, three angles, and three surfaces. Okay, let's move to surfaces now. Let's start with the costal surface, the front surface. This part touches the ribs. It has a big depression called the subscapular fossa, and inside this you have the subscapularis muscle. So you remember it like this: front, subscapularis, done. Now turn the bone around, we see the dorsal surface, the back. Here is the most obvious feature, the spine of the scapula. This ridge divides the back into two compartments: above, supraspinous fossa; below, infraspinous fossa. And of course, supraspinatus sits above and infraspinatus sits below. Borders. Now let's look at the three borders. Medial border towards the vertebral column. Lateral border towards the armpit. Superior border, the small top border. Angles. Since we have three borders, where they meet, we get three angles: superior angle, inferior angle, and lateral angle. Now, the lateral angle is the most important, but why? Because this angle contains the glenoid cavity, the socket where the humerus fits. So, shoulder joint is equal to humeral head plus glenoid cavity. Glenoid cavity plus tubercles. Okay, the glenoid cavity is shallow. You might question me why shoulder joint is so much flexible. Simple, because the socket glenoid is shallow. Above the cavity, we have the supraglenoid tubercle for biceps. Below, we have the infraglenoid tubercle for triceps. So it's just biceps above and triceps below. Processes. Now we come to the processes of the scapula. These are like small extensions. We have three main ones. Spine of scapula, the big ridge. Acromion process forms the roof of the shoulder. Coracoid process, the small curved hook in the front. Coracoid process is like a muscle party area, lots of muscles attached here. Pectoralis minor, short head of biceps, coracobrachialis. Alright, suprascapular notch. There is also a small notch on the superior border called the suprascapular notch. One super easy mnemonic: Army over Navy. Artery goes over, nerve goes under. You'll never forget this. Movements of the scapula. Now, this part is interesting. The scapula is always moving, even when you don't realize it. Try lifting your arm overhead. Your scapula rotates upward. Try pulling your shoulder back. Your scapula retracts. Movements include elevation, depression, retraction, retraction, upward rotation, and downward rotation. And these movements are the reason we can throw, lift weights, climb, and reach objects. So, if scapula freezes, shoulder becomes useless. Muscle attachments. I know muscle attachments sometimes look scary, but for scapula, it's extremely simple because most shoulder muscles take origin here. Just remember the big ones. Subscapularis on the front. Supraspinatus, infraspinatus on the back, deltoid on acromion and spine, trapezius on the spine, rhomboids on medial border, serratus anterior on medial border, corsal side. These are the muscles that stabilizes your scapula. Without them, the bone cannot maintain its position. Applied anatomy. It's very important. There are two conditions you must know: scapular winging and shoulder impingement. The first condition, scapular winging, when the medial border sticks out like a wing. This happens when serratus anterior is weak, usually due to injury to the long thoracic nerve. The second condition, shoulder impingement. This happens when there is inflammation in the supraspinatus tendon passing under the acromion. For both conditions, scapular movement becomes abnormal. Okay, let's do a quick self-check. What muscle occupies the subscapular fossa? Subscapularis. Which structure divides the posterior surface of the scapula? The spine of the scapula. Supraglenoid tubercle gives origin to which muscle? Long head of biceps brachii. What lies above the spine? Supraspinous fossa. Which nerve passes through the suprascapular notch? Suprascapular nerve. Remember, army over navy, artery over, nerve under. Before we end, let me just summarize the entire scapula quickly. Triangular bone on the back of the chest wall. Has 3 borders, 3 angles, 3 surfaces. Spine divides the dorsal surface. Glenoid cavity forms the shoulder joint. Acromion coracoid is equal to major processes. Muscles around the stability. Scapula moves freely, gives shoulder mobility. So muscles all around are for the stability. Without good scapular movement, shoulder dysfunction. And that's your scapula completely done. Thank you.